September 11th, 1942. 120 feet beneath the South China Sea. The cramped wardroom of the USS Sea Dragon suddenly became the most unlikely operating theater in naval history. Pharmacist's mate Wheeler Lipes gripped a bent tablespoon in one hand and a makeshift scalpel in the other, staring down at 19-year-old seaman Darrell Rector, whose life hung in the balance. This would be the moment that changed submarine warfare forever. The day one man's desperate surgery with kitchen utensils would eventually save not just one sailor, but hundreds of submariners across the Pacific Fleet. The story of how Wheeler Lipes became the most unlikely hero of World War II doesn't begin with glory. It begins with a terrified young pharmacist's mate, facing an impossible choice in the belly of a steel tomb, surrounded by enemy waters, with no way to surface, no way to call for help, and no doctor within 1,000 miles. What happened next would revolutionize naval medicine, challenge military hierarchy, and prove that sometimes the difference between life and death comes down to one person's willingness to pick up a rusty knife when everything else has failed. To understand why Wheeler Lipes' surgery represented such a radical break from naval procedure, you must first understand what American submarines were never supposed to do. In 1942, submarine medical protocol was brutally simple. If a crew member became seriously ill beyond the wardroom, the submarine surfaced and radioed for evacuation. If surfacing meant certain death, the submarine commander followed standing orders. Ice the patient, restrict to liquids, and pray he lived until you could reach port. Wheeler Bryson Lipes should never have been on a submarine in the first place. Born July 12, 1920 in Newcastle, Virginia, he was a high school dropout who joined the Navy at age 16 with dreams of adventure. His path to medical training came through persistence rather than privilege. After serving on the battleship USS Texas, Lipes requested transfer to hospital training in San Diego, where he learned to operate an electrocardiograph machine and assist Navy doctors during routine procedures. By 1941, Lipes had earned classification as an electrocardiographer and served at naval hospitals in Philadelphia and Manila. He was competent, quiet, and thoroughly unremarkable. Then came his request for submarine duty, a decision that puzzled his commanding officers. Why would a hospital technician want to serve on boats where medical facilities barely existed? Lipes never fully explained his motivation, but on October 15, 1941, he reported aboard the USS Celeon at Cavite Navy Yard in the Philippines. He almost died before the war officially began. On December 10, 1941, just 3 days after Pearl Harbor, Japanese bombers struck Cavite Navy Yard with devastating precision. The USS Celeon, Lipes' assigned submarine, took a direct hit that killed several crew members and left the boat a total loss. Shrapnel from the explosion wounded Lipes and scattered metal fragments across the sister submarine USS Sea Dragon, moored nearby. As smoke and flames consumed the naval yard, Lipes crawled through the Celeon's forward torpedo hatch, dropped into the harbor, and swam to safety. That night, as he treated wounded sailors in a makeshift aid station, Wheeler Lipes made a decision that would define his war. He volunteered for transfer to the USS Sea Dragon, taking the place of a dead shipmate. It was December 12, 1941. America had been at war for exactly 5 days. USS Sea Dragon, designated SS-194, was a Sargo-class submarine built for long-range patrol operations in the Pacific. At 210 feet long with a crew of 55 men, she represented the cutting edge of American underwater technology. Her mission profile called for extended patrols lasting 60 to 70 days in enemy-controlled waters, hunting Japanese shipping and gathering intelligence. Medical facilities consisted of a small sick bay with basic supplies, sufficient for treating minor injuries and common illnesses. Serious medical emergencies were not anticipated because submarines always maintained radio contact with headquarters and could surface for evacuation if necessary. This assumption proved catastrophically wrong. By September 1942, American submarines operated deep in Japanese-controlled waters, where surfacing meant certain death. The USS Sea Dragon was 8 days into her fourth war patrol, cruising submerged off the Indonesian coast, when Seaman First Class Darrell Dean Rector first complained of stomach pain. September 8, 1942. Rector, celebrating his 19th birthday, approached Lipes in the after-battery compartment. "Hey, Doc, I don't feel very good." The symptoms seemed minor. Nausea, mild abdominal discomfort, loss of appetite. Lipes prescribed rest and observation, standard treatment for upset stomach. But over the next 48 hours, Rector's condition deteriorated rapidly. The fever came first, climbing to 102.4 degrees. Then the telltale signs that turned routine illness into life-threatening emergency. Rigid abdominal muscles, acute pain localized in the right lower quadrant, rebound tenderness when pressure was released. Wheeler Lipes had seen these symptoms before during his hospital training. He knew exactly what they meant. Acute appendicitis. Without surgery, Darrell Rector would die. On the morning of September 11th, Lipes reported to Lieutenant Commander William Farrell, the Sea Dragon's commanding officer. The diagnosis was appendicitis. The prescription was immediate surgery. The problem was that no one aboard the submarine had authority to perform major surgery. Navy regulations explicitly prohibited corpsmen from conducting operations beyond their training level. The nearest qualified surgeon was thousands of miles away in Fremantle, Australia. Commander Farrell faced an impossible choice: surface the submarine and radio for evacuation, exposing his crew to almost certain attack by Japanese anti-submarine forces, continue the patrol and watch Rector die from peritonitis when his appendix burst, or authorize his pharmacist's mate to attempt surgery that could kill the patient and might result in court-martial for everyone involved. Farrell went to Rector and explained the situation. No doctor available, no possibility of evacuation, surgery by an unqualified corpsman, or certain death from ruptured appendix. Rector, writhing in agony, gave his answer without hesitation. "Whatever Lipes wants to do is okay with me." Those 8 words changed naval history. What happened next violated every regulation in the Navy Medical Manual. Commander Farrell ordered Wheeler Lipes to perform an emergency appendectomy 120 feet beneath the surface, in enemy waters, using whatever equipment he could improvise. It was probably the most illegal medical procedure in naval history. It was also Darrell Rector's only chance of survival. The operating room was the wardroom mess table cleared of charts and coffee cups, scrubbed with alcohol until it gleamed. The surgical instruments were improvised from kitchen equipment. 12 small hemostats from the ship's medical kit. Scalpel blades mounted on hemostats for handles. 5 tablespoons with handles bent backward to serve as retractors. Number 0 chromic catgut for sutures. Everything sterilized by boiling in the galley. The anesthetic was ether, administered through a tea strainer lined with gauze. The surgical gowns were pajamas soaked in alcohol. The operating lights were torpedo-loading lamps brought down from the torpedo room. The operating table was positioned so that the patient's head pointed toward the bow, ensuring that if the submarine had to dive suddenly, blood would not flow into the patient's lungs. At 10:46 a.m., Lipes began administering ether to Darrell Rector. The submarine was cruising at 120 feet, maintaining course and speed to avoid detection. The cabin pressure was 2 inches of mercury above atmospheric pressure, which meant ether absorption rates were completely unpredictable. Too little anesthetic and Rector would wake up during surgery. Too much and the increased pressure could kill him. Lieutenant Frederick Hoskins took over anesthetic administration once Rector was unconscious, allowing Lipes to focus on surgery. Commander Farrell positioned himself at the patient's head, taking vital signs every 1 to 4 minutes and recording observations in the ship's log. The entire crew knew what was happening. Word traveled from compartment to compartment. "They're cutting him open. Doc's operating. The kid's going under the knife." At 11:07 a.m., Wheeler Lipes made his first incision. 3 inches long, precisely positioned over McBurney's point. the anatomical landmark for appendix location. Blood welled up immediately. Lipes had no suction equipment, no retractors except bent spoons, no proper lighting except torpedo lamps that cast harsh shadows across the operative field. He cut through skin, then subcutaneous fat, then muscle, following the anatomical planes he had memorized during hospital training. Each layer had to be identified, isolated, and carefully divided. Blood vessels required ligation with catgut sutures. Muscles had to be separated along natural lines to avoid permanent damage. Every movement was deliberate, precise, irreversible. Then came the moment of terror. Lipes reached the point where the appendix should be located, slipped his finger under the cecum, and felt nothing. Empty space. For a heart-stopping second, he wondered if Darrell Rector had situs inversus, a rare condition where organs are positioned on the opposite side of the body. If the appendix was on the left side instead of the right, Lipes had just made a fatal error. He extended his exploration, probing deeper, fighting panic. Then his finger found it. The appendix, exactly where it should be, but swollen to nearly twice normal size. 2/3 of the 5-inch organ was black with gangrene. Another few hours and it would have burst, flooding Rector's abdomen with infected material and killing him within days. Lipes carefully isolated the appendix, applied clamps to control bleeding, and amputated the infected organ. He cauterized the stump with phenol, then neutralized the phenol with alcohol to prevent tissue damage. He sprinkled sulfa powder, ground from tablets and baked in the ship's oven, into the peritoneal cavity to prevent infection. Penicillin did not exist in 1942. Layer by layer, Lipes closed the incision. Peritoneum first, then muscle, then subcutaneous tissue, then skin. Each suture had to be perfect. There would be no second chance, no do-over, no backup plan if infection set in. At 1:22 p.m., 4 hours and 36 minutes after he made the first incision, Wheeler Lipes tied the final suture. Darrell Rector regained consciousness 30 minutes later, groggy but alive. The first submarine appendectomy in naval history was complete. The patient would make a full recovery and return to duty within a week. But the implications of what had just happened would reverberate through the Navy medical establishment for years to come. The USS Sea Dragon continued her patrol for 6 more weeks. Rector healed perfectly, the incision closing without infection, his strength returning daily. When the submarine finally returned to port in Australia, the squadron medical officer examined both patient and appendix. His conclusion was unequivocal. Lipes had performed flawless surgery under impossible conditions. Without the operation, Rector would have died within hours. But the Navy medical hierarchy was furious. Rear Admiral Ross McIntyre, the Navy Surgeon General, considered the surgery a dangerous precedent that could encourage unqualified personnel to attempt procedures beyond their training. There was serious discussion of court-martial proceedings against both Lipes and Commander Farrell. The operation, while successful, violated fundamental principles of military medical practice. Those concerns proved justified in an unexpected way. Word of the successful surgery spread rapidly through the submarine fleet. Other commanding officers facing similar emergencies began authorizing their pharmacists' mates to attempt surgery. On Christmas Eve, 1942, pharmacist's mate Thomas Moore performed an appendectomy aboard the USS Silversides while submerged off Rabaul. 2 weeks earlier, pharmacist's mate Harry Roby had operated aboard the USS Greyback in the Solomon Islands. 3 successful submarine appendectomies in 4 months represented either remarkable luck or proof that Navy hospital training was far more effective than anyone realized. The medical establishment chose to view it as dangerous precedent. In 1943, Commander Submarines Pacific issued explicit orders prohibiting further appendectomies by unqualified personnel. Submarines would carry detailed protocols for non-surgical treatment of appendicitis, including ice therapy and antibiotic administration, until patients could be evacuated. But the damage to medical orthodoxy was already done. Wheeler Lipes had proved that properly trained corpsmen could perform complex surgery under conditions that would challenge experienced surgeons. More importantly, he had demonstrated that submarine crews possessed capabilities far beyond their official ratings when lives depended on individual initiative and training. The story became a national sensation when Chicago Daily News reporter George Weller gained access to the patrol report and wrote a detailed account of the surgery. His article, published December 14, 1942, won the Pulitzer Prize for distinguished reporting. Weller's vivid description of the operation captured American imagination during a period of devastating military defeats in the Pacific. Hollywood took notice immediately. The 1943 film Destination Tokyo, starring Cary Grant as a submarine commander, featured a dramatic recreation of the appendectomy scene. Radio programs, magazine articles, and newsreels made Wheeler Lipes a national hero. The quiet hospital technician who had dropped out of high school became the face of American ingenuity and determination. But heroism came with a price. Navy medical officers ostracized Lipes for his unauthorized surgery, despite its success. Fellow corpsmen resented the attention he received for doing what many of them could have done given the same circumstances. Lipes found himself caught between public acclaim and professional isolation, celebrated by civilians and shunned by the medical community that had trained him. The broader implications of the Sea Dragon surgery extended far beyond one man's fame or one Navy's embarrassment. Lipes had proved that emergency surgery was possible under conditions previously considered impossible. His success suggested that other emergency procedures might be feasible with proper training and equipment modification. More significantly, the surgery challenged fundamental assumptions about medical hierarchy and authority. For centuries, surgery had been restricted to university-trained physicians who served lengthy apprenticeships under qualified surgeons. Lipes was a high school dropout with 3 years of hospital training who had never performed major surgery. Yet his operation succeeded where traditional medical thinking said failure was inevitable. The implications reached beyond medicine into broader questions of training, authority, and capability under extreme conditions. If a pharmacist's mate could perform successful surgery, what other extraordinary feats were possible when necessity demanded innovation? The submarine service began examining its training programs, looking for ways to expand crew capabilities without compromising safety or violating regulations. These examinations revealed that many submarine corpsmen possessed skills far beyond their official ratings. Years of close collaboration with Navy doctors had given them practical knowledge that formal training programs never recognized. They could diagnose complex conditions, treat trauma injuries, and manage medical emergencies that would overwhelm civilian paramedics. The submarine appendectomies proved this informal training was remarkably effective. By 1944, the Navy began quietly expanding corpsman training to include emergency surgical procedures. The official position remained that major surgery should be performed only by qualified physicians. The unofficial reality was that submarine corpsmen received instruction in emergency appendectomy, wound repair, and trauma surgery. If circumstances required unauthorized procedures, at least those procedures would be based on proper training. The impact extended to other military services as well. Army medics and Air Force flight surgeons studied the submarine surgeries, looking for lessons applicable to their own extreme conditions. If Navy corpsmen could operate successfully underwater, perhaps Army medics could perform surgery in forward combat zones where evacuation was impossible. Wheeler Lipes never intended to revolutionize military medicine. He was simply trying to save the life of a 19-year-old shipmate who faced certain death without surgery. But his willingness to attempt the impossible when regulations offered no solutions changed how the military thought about medical training, authority, and capability under extreme conditions. The revolution was not limited to surgical technique. Lipes had proved that successful emergency medicine depended more on training, preparation, and individual initiative than on formal credentials or perfect equipment. His improvised instruments worked as well as hospital surgical tools. His makeshift operating room was as effective as a naval hospital. His success demonstrated that medical miracles were possible when competent people refused to accept that nothing could be done. These lessons proved invaluable as the war expanded, and American forces faced medical emergencies in locations where traditional support was impossible. Combat medics performed surgery in foxholes. Flight surgeons operated in aircraft. Hospital corpsmen saved lives using equipment that would have been considered inadequate in peacetime. The submarine appendectomies had shown that emergency medicine was limited more by imagination than by resources. Darrell Rector returned to full duty aboard the USS Sea Dragon and completed the submarine's fourth war patrol without complications. His recovery was so complete that when the submarine reached port, squadron medical officers initially refused to believe that major surgery had been performed. Only examination of the healed incision and the preserved appendix convinced them that the operation had actually occurred. Rector remained grateful to Leipz for the rest of his life, but that life was tragically short. On October 24, 1944, Rector was serving aboard the USS Tang when the submarine's own torpedo circled back and struck the boat in the stern. The Tang sank with nearly all hands. Rector was among the dead, killed 2 years after Wheeler Leipz had saved his life with a rusty knife and kitchen spoons. The irony was not lost on submarine veterans. Leipz had performed perfect surgery to save Rector from appendicitis, only to lose him to one of the war's most bizarre accidents. But the 2 years Rector lived after his surgery allowed him to serve with distinction on multiple war patrols, contribute to the submarine campaign that strangled Japanese shipping, and die fighting for his country rather than from preventable disease. Wheeler Leipz himself survived the war, but never received official recognition for his surgical feat until 6 decades later. The Navy medical establishment remained embarrassed by the unauthorized surgery, despite its success. Leipz was transferred away from submarine duty and spent the remainder of the war participating in bond drives and factory visits, using his fame to support the war effort from the home front. After the war, Leipz completed his education through GED programs and attended George Washington University. In 1951, he was commissioned as an ensign in the Navy Medical Service Corps and served as a finance officer and hospital administrator. He retired from active duty in 1962 and worked in civilian hospitals until 1991, eventually becoming president of Memorial Medical Center in Corpus Christi, Texas. On February 20, 2005, more than 60 years after his historic surgery, Wheeler Leipz finally received official recognition for saving Darrell Rector's life. At a ceremony at Camp Lejeune, North Carolina, he was awarded the Navy Commendation Medal. At age 84, he was reunited with Arthur Killiam, another Sea Dragon veteran who had assisted during the operation. Leipz died of pancreatic cancer just 2 months later on April 17, 2005. He was buried at Arlington National Cemetery with full military honors. His grave marker identifies him simply as Lieutenant Commander Wheeler B. Leipz, United States Navy. It makes no mention of rusty knives, kitchen spoons, or the submarine surgery that changed naval medicine forever. But the legacy of that surgery lived on in ways Leipz never fully understood. The techniques he improvised became standard training for submarine corpsmen throughout the Pacific Fleet. His success encouraged medical innovation that saved hundreds of lives during the war's final years. Navy doctors began teaching emergency surgical procedures to corpsmen serving in isolated locations where physician support was impossible. The psychological impact was equally important. Leipz had proved that desperate situations sometimes demanded desperate measures, and that properly trained personnel could achieve extraordinary results when traditional methods failed. His willingness to attempt the impossible when regulations offered no solutions became a model for military medicine in extreme conditions. The 300 men referenced in Wheeler Leiph's story were not saved directly by his single surgery. They were saved by the revolution in submarine medicine that his surgery initiated. When other submarines faced similar medical emergencies, their corpsmen knew that surgery was possible. When training programs expanded to include emergency procedures, more submarine crews developed the skills needed to save lives under impossible conditions. The number represents all the submariners who lived because one pharmacist's mate proved that a rusty knife and kitchen spoons could perform miracles when wielded by trained hands guided by desperate determination. Every submarine that carried a corpsman trained in emergency surgery procedures owed a debt to Wheeler Lipes and his willingness to violate regulations to save a shipmate's life. The broader lesson of the Sea Dragon surgery transcended military medicine. Lipes had demonstrated that innovation often emerges from necessity rather than planning, that extraordinary achievements are possible when competent people refuse to accept impossible situations, and that individual initiative can change institutional thinking in ways that formal reform efforts never achieve. His story became a template for crisis leadership that extended far beyond naval warfare. Business schools studied his decision-making process. Medical schools examined his improvisation techniques. Military academies analyzed his willingness to accept responsibility for outcomes beyond his official authority. The high school dropout who performed surgery with kitchen utensils became an unlikely case study in leadership under extreme pressure. Today, military medical training incorporates lessons learned from the submarine appendectomies. Corpsmen receive extensive instruction in emergency surgical procedures. Forward medical units carry portable surgical equipment designed for use in impossible conditions. The assumption that major surgery requires perfect facilities and unlimited resources has been replaced by recognition that skilled practitioners can achieve remarkable results with minimal equipment when lives depend on their success. Wheeler Lipes never set out to revolutionize military medicine or challenge medical authority. He was a young sailor trying to save a friend's life with whatever tools were available. But his willingness to attempt the impossible when everything else had failed changed how the Navy thought about training, capability, and innovation under extreme conditions. The rusty knife he used was not actually rusty. The scalpel blades were sharp and sterile, mounted on hemostats that served perfectly well as surgical handles. But the phrase captured something essential about his achievement. He had taken ordinary tools, applied extraordinary skill, and accomplished something that medical orthodoxy considered impossible. That achievement reverberates through military medicine today. Every time a combat medic performs surgery in a forward position, every time a flight surgeon operates in an aircraft, every time a hospital corpsman saves a life using improvised equipment, they follow in the footsteps of Wheeler Lipes and his impossible surgery beneath the South China Sea. September 11, 1942 began as just another day of submarine patrol for the USS Sea Dragon. It ended as the day that changed naval medicine forever. Wheeler Lipes picked up his rusty knife, bent his tablespoons, and proved that miracles were possible when trained hands refused to accept that nothing could be done. Darrell Rector lived. 300 other submariners would live because of what Lipes proved that day. And somewhere in the South China Sea, 120 feet below the surface, the impossible became routine because one man had the courage to try.